Thank you everyone for coming. We are going to be presenting a panel called Roll Up Your Sleeves, Primary Data Collection in Humanitarian Settings. And I want to start by introducing my co-panelists and myself. I'm an emergency medicine doctor. My name is Kelli O'Laughlin, and I'm an emergency medicine doctor in Boston at Brigham and Women's Hospital and Harvard Medical School. And I conduct research among refugees in Uganda, studying engagement in HIV care and interventions to improve engagement in care. And I'm going to tell you about my colleagues. This is Dr. Eric Nilles. He's an emergency medicine physician at Brigham and Women's as well. And he is the director of the program on infectious diseases and humanitarian emergencies at the Harvard Humanitarian Initiative. And he has extensive experience working with both MSF and WHO, conducting field studies and epidemiologic studies in over 20 developing countries. To his left is Dr. Nirma Bustamante. She's an International Emergency Medicine Fellow in the Department of Emergency Medicine at Brigham and Women's Hospital. And she conducts research on health effects of war and conflict on refugees and internally displaced populations in Uganda, Colombia, and Iraq, as well as gender-based insecurity in urban slums of Haiti, Ethiopia, and Bangladesh. Excitingly, she's about to start in a couple of months, epidemic intelligence officer. She's going to be training to be that at the CDC, so we're very proud of her for that. To her left is Dr. Parveen Parmar. She is the Chief and Division of International Emergency Medicine at University of Southern California, as well as Associate Professor of Clinical Emergency Medicine at the Keck School of Medicine. And she conducts research in conflict and post-conflict settings focused on health and human rights, gender-based violence, and provision of health care to conflict-affected displaced populations in multiple settings globally. She also has experience teaching graduate courses on field research methods. And to her left is Dr. Michelle Nisharenko. She's the Director of Global Health Programs at Boston Children's Hospital, pediatric emergency medicine attending at Boston Children's Hospital, as well as instructor of emergency medicine and pediatrics at Harvard Medical School. Dr. Nisharenko has experience in pediatric care and program development in over 10 countries, and for the last 8 years has worked in Liberia to provide pediatric humanitarian aid to partner local infrastructures and to U.S. academic institutions. And from 2014 to 2015, during the Ebola outbreak in Liberia, she led the hospital public health response. And more recently, she has helped implement a national program for hospital quality improvement and emergency care training in Liberia. So with that introduction, now we are going to share with you we're going to introduce to you problems as well as examples of how we've seen these problems in the field and solutions that we suggest or have found in our experiences, starting with Dr. Eric Nilles.